webinar will be made available to all attendees. And at this time, I'd like to turn it over to our moderator, Tim Rowan, the founder and president of Rowan Consulting Associates. Tim.
Thank you very much, Ryan. And hello, everybody. I'm really pleased and honored to be the moderator of this discussion today. I think you'll find it extremely interesting. I'm going to leave most of my comments for the end, but first I'd like to introduce to you your panelists. Melissa Kozak, who is a registered nurse, has been in home care for a number of years. She works in New York City and is the co-founder and serves as the CEO of Citus Health. The reason that she founded this company is because her experience as a nurse helped her to discover the problems with communication, and especially as they regard care coordination, where frontline clinical teams, the individuals, whether nurses or aides in the home, were having difficulties with communication and sometimes lapses that had an effect on care when they were moving from home to home and rarely in the office. And the technologies that she saw available in those days to communicate with family members were getting a little old in the tooth. And there were delays. The quality of care was being impacted just because of communications. So after struggling with that particular problem and recognizing those needs for a number of years, she put together a team of healthcare technologists and created this company called Citus Health in 2016, and has been trying to tackle these challenges ever since by putting together a solution, a real-time solution, a HIPAA secure solution that ensures a high level of coordination, care team coordination, especially family engagement. And that's one of the things we're going to be talking about today, the impact on patient satisfaction when the family is happy. So I can't wait to hear what Melissa has to say. We've done a little rehearsal and I have not heard the whole thing. I'm as anxious as you are to hear this story. She's going to be accompanied by VP of Business Development at Citus Health. Rob Stoltz has been around home care for, gosh, what is it, Rob? 50, 60, 70 years, something like that. I've met Rob a number of times at conferences and have always been impressed with his knowledge of the products and the needs of the industry. So for 25 years, to tell the truth, in post-acute care, Rob has developed a great deal of expertise in the domain. His track record is working with companies to increase revenue, operational efficiencies, and he has been working with a number of high-growth technology companies over the years. And I think that he chose Citus because he was impressed with what he saw. After working with those large technology organizations, most recently at Brightree as a senior director of business development, he has developed an expertise in home health, hospice, and private duty sales. So he knows the industry's history, he knows the current status, and he knows where it's going. He sees the needs of all types of post-acute care as they move forward in an increasingly competitive landscape. So I know Rob to be a person who has a passion for making technology available that can improve your ability to provide care in the home, improve the lives of patients and the lives of caregivers too. So you put this all together, his broad range of strategic knowledge, the tactical roles that he has fulfilled in a variety of sales and marketing and product management positions. I think he's perfectly positioned to drive the growth of Citus Health, and therefore, because of Melissa's knowledge and Rob's experience and abilities, you're going to see a lot about Citus Health in the near future. He is going to work on their direct sales efforts, strategic partnerships. The article that I wrote about him in Home Care Technology Report, the Rowan report, was kind of a survey of where they've been so far. And even since that article, they've moved quite a ways already into the future. So I'm going to step out of the way and let these two take it over because they have a lot to offer. So just real quickly, before I do that, let me tell you what we're going to tell you. There has been a research study by Porter Research that demonstrated clearly that families give increased satisfaction scores to a hospice that has an emphasis on communications. Because the research study focused on hospice, you might be inclined to think that that's all we're going to talk about, but the same thing is going to be true for home health and home care as well. So if you have a communication tool that can improve your ability to communicate with the patient and the family, it results in better satisfaction scores. That's the summary, and I don't want to put words into Robin and Melissa's mouth, so let me just run through the agenda and turn it over. We're going to be talking first about today's challenges with regard to communications. We're going to talk about what the research study showed us with regard to what the family caregiver really wants. Sometimes your assumptions are not correct. We're going to show you how that satisfaction within the family shows up on your CAP scores, shows up with your referral sources, and even affects your productivity. And ultimately, I'll come back at the end and talk to you a little bit about your reputation as a caregiving organization and the influence of your online reputation. And then we'll leave time, if I stop talking, for questions and answers at the end. So here we go. That's the outline. Are you ready, Rob? Take it over.
Hey, Tim, thanks very much. I appreciate the introduction and certainly the kind words. And we're excited today to be with you and then talk about what we say is the voice of the family caregivers. So just to kind of set it up, in July, we commissioned a study with Porter Research on 300 family caregivers that had cared for a loved one in hospice over the past 12 months. Okay, and then we wanted to understand whether family caregivers were satisfied with the different ways that they were communicating with hospice providers. And then we wanted to understand and rate the impact of the communication methods as they relate to the CAP surveys, which obviously is important to the providers. And then find out what family caregivers want from hospice providers in terms of communication. So what is it? If they're not getting it now, what is it? And so, you know, on a side note here, but I think relevant, a year ago at this time, my dad was in hospice. And although I was not the direct family caregiver, as many of you on this call know, just because you're in this industry, you're going to then be called on to heavily influence the activity because you know the space. So my 80-year-old mom was the caregiver, but she doesn't know a lot about hospice. And so from a distance of 300 miles away from where my parents are, I was actively engaged. So while I wasn't the direct caregiver, I'm going to share with you a few of the experiences I had because, of course, that's the same scenario that the hospices are dealing with is these people who are trying to take care of parents from a distance as well. So I've got some insight into that I'll share. And then, you know, on the following slides, we're just going to kind of let you know what the responses were and look into the important findings of the survey. So we're going to start off on why we're talking about the family caregivers. And so, you know, the real reason why we're talking about the family caregivers is because they're the consumer, right? Meaning that they're going to make, during the hospice care, they're going to help to make choices for their mother, their father, their spouse, whoever it may be. And then they're also going to be influential in picking the hospice that their loved one's going to be serviced by. And then at the end of the stay, you know, whenever you get the CAP scores and the surveys and you're going to get overall satisfaction and rankings and quite frankly, word of mouth, just as importantly in this industry sometimes, they're going to be the ones doing it. And so it's really important to talk about, you know, and we haven't really seen studying on that family caregiver. And so outside of the in-person visit, the hospice providers rely on a bunch of different communications, right, to talk with these caregivers. And it, you know, revolves a lot, as we know, around phone and text and email, and that makes up about 80% of the communications. And so when we surveyed the consumers, these family caregivers we're talking about, they told us overwhelmingly, over 90%, that the method of the hospice uses to communicate will influence their overall satisfaction. That's an extraordinary number, is 80%, or I'm sorry, over 90% of the caregivers. And so what we're really hearing is that's going to be a big impact. And when we look a little bit more specifically at this second chart, we break that down by each method of communication. And you can see that anywhere from 50 to 70% of the family caregivers said that the method of communication had a major influence on their overall satisfaction with their hospice provider. So when you think about that, you know, there's been a ton of technology advances in the hospice industry, but have it really properly invested in how to communicate with family and family caregivers? And are they happy with the methods that the hospices are using today? And so as we look at, you know, we understand now the importance that they're saying it's important, right? Now, given the importance of that communication method and the overall caregiver experience, we wanted to understand how satisfied are you with the hospice communication today? And so the most relevant way to do that seemed to be measure their satisfaction in terms of the CAPS survey responses. So we asked caregivers about their satisfaction with their recent hospice experiences on really 4 publicly reported CAPS survey responses that are most closely tied to communication. In this case, 57% of family caregivers told us that hospices and providers need improvement when it came to 4 communication categories. So if we look a little bit more specifically and break down those categories, it's really in terms of general communication with the family, timely access to help, the training and education for the family, and then emotional and support during and after the hospice stay. And it's kind of interesting when you start talking about the family, because I come from a large family. So not only am I helping my mom in the hospice decisions, but then communicating with that family external and siblings as well. So we can't overlook that. And what we can see here is that the responses are fairly similar in their rankings, but that the timely access to help, if you need it, rank the lowest in terms of satisfaction. So obviously in the hospice setting, the ability to react quickly to a patient or a family caregiver can be the difference between an unnecessary ER or hospital visit and potentially the revocation of the hospice benefit as well. So some really important findings on these initial 2 slides that we wanted to start off by sharing with you there. When you start to drill down into it, here's the problem. The providers today are just relying on technologies that are outside the norm. They are traditional in nature, like email and text messages and phone, to communicate with family caregivers. And so many times, you know, today the family caregiver is the daughter or the son, and they group in an age range largely between 44 and 65 years old. I know by my picture at the end, you can't believe I've fall into that age range yet, but it's true. So this applies to me as well, right? And so what's happening is we're running our lives in more real-time ways and on our apps and on our mobile devices. And so it doesn't matter whether you're making a purchase on Amazon or you're reading the news or doing social media or whatever it is, that's how we're interacting in most of our day-to-day lives. However, in hospice, 80% of the time, providers are using phone, email, and text, which are not necessarily the tools that we're used to accommodating. So we're kind of using a channel that we're not familiar with in our day-to-day lives to do it. And in our research, we found that these 3 methods of communication are just not resulting in the immediate response to the family caregiver needs. And in that end of life, that can make a big difference whenever you're talking about an unnecessary ER visit that may take place, or a hospitalization, or a revocation of hospice benefit. And not being able to get those responses at that time, it just increases the caregiver family stress during that time. And so, you know, and I can tell you just, even when it's not a critical situation, like could result in an ER visit, it can still just provide a level of inconvenience for the caregiver or the family. As a side example, just wanted to find out if I could take my dad away for a few days, right? And determine what was the coverage there. And, you know, could I take him, and how would we, if we had a problem, how would we address that? And that resulted in 3 days of phone tag just to make that determination, right? And that's not a fault of the hospice. The hospice, you know, I have a busy schedule, they have a busy schedule. I'm calling, they can't get on. But when you look at it, it's really a matter of the technology just doesn't meet the need anymore. So when we look at it and we say only 59% of family caregivers said they always receive immediate response from a phone call. Well, the nature of a phone call is if you call and someone's busy, you're going to go to voicemail. They're going to try to call you back and you're busy and you're just going to play the game. We all know it. And 50% said they got an immediate response to a text message. So text is a whole nother issue. I can tell you my 80-year-old mother was texting back and forth, but while she is a retired nurse, she doesn't know what PHI is. And the nurse and the caregiver she's trying to text are probably providing other care to other patients, right? And so they're not going to be able to do that immediate response if it's that one-to-one kind of scenario and the other party is not there. So, and then 43%, they got an immediate response from an urgent, from email. And really, we all know email is not an urgent response. Maybe back in when it started and we got excited by every email, but now that we have 500 emails, it's just not the right tool to be able to do that. And so you get caught up in these phone tag situations. I can tell you of a personal situation where we wanted to get a hospital bed into the home, and it took 7 phone calls to make that happen, right? The nurse who was at the home calls the hospice, who calls the DME company, who calls the hospice back, and then the hospice calls the nurse and notifies her that they can do that, and the nurse has since left, so calls my mom again and says, yeah, we can do that, and then the DME calls later, right? And then, by the way, I'm 300 miles away wondering what's going on as well. And so the tools that they're using just don't do that. And so we'll talk about how a little bit later, the software can allow you to have that all on one nice, secure chat that we can all be involved in. So there's just some real life examples that I've experienced. I'm sure everybody on the phone here has as well, because most of you folks have gotten into hospice for a reason. The other part of it is, you know, there's no real technology of those ones that are being used that kind of has this urgency to it. So in other words, if you call and you miss somebody, it's going to sit there like every other voicemail, every other email. And so there's no kind of an auto escalation, or how do you escalate these things if they don't get responded to? And it's important that they're telling us how important this is, and now you have to kind of act like it is, right? You have to kind of take different action because they're used to living a life on these other apps that are more instant gratification. So I'm sure many of you have been in similar situations, experienced that kind of phone tag frustration and so forth. So you just don't want to put that kind of stress in a family that's dealing with an end of life situation. Okay. So as we look at the family caregiver, we're going to, you know, it's the missing ingredient here is really communication with that family caregiver. And it's the ability to communicate real time via more modern means, like a computer, a tablet, or a smartphone, right? How we interact normally in our day-to-day lives. So when we ask family caregivers how valuable it would be for hospices to communicate with them in real time through something that's more modern than a phone call, such as a computer, tablet, or smartphone, you can see that 69% of the folks said it would be very valuable. That's an enormous number. And a full 95% said it would be at least somewhat valuable. Now, here's the interesting part, right? Hospices generally don't talk about how they communicate with you when you meet with them, right? I met with multiple hospices in selecting care for my dad, and nobody said, hey, here's how we're going to communicate with you. So I see that as an opportunity to let them know this. Right? If we now know from the study that that's important, then it's important for you now to let them know how you're going to do it. And that, you know, they're telling you it's important, right? This is important to us, but they don't think of it, quite frankly. When we're sitting there meeting with hospices, we're worried more about the medical care and we're talking about the clinical care and things like that. We don't necessarily, as people who are shopping for services, think about this, but it's a real opportunity for your organizations to say, hey, here's how we're going to do it. and give me that nice comfort that I'm going to be able to immediately do it through these modern tools. And so, you know, as we talked about earlier, these tech savvy consumers, it's real-time communication in every other facet of their lives. So make it a point to make them know that you're going to be able to say, yeah, we're going to be able to do that with you just like you're used to, right? And then we really need to look at, so where are we today, right? Where's the industry stand today as far as investing in the caregiver experience? And so earlier in the year, we did some work with Home Healthcare News on a provider survey. And some of the key results are here, right? Where it says only about a quarter of the providers were completely satisfied with their investment in family engagement tech. So because of COVID, people had to start doing some of this where they needed to enhance their technologies. It was frequently just a Band-Aid kind of fix. And only about a quarter of them then said that they're satisfied with that. Almost half, 44%, they don't use a technology platform today to engage with families and patients. They may use it to engage with their own staff, but not patients and families. And then about 3/4 of providers surveyed, they still want to increase that, right? They still want to increase how they're engaging their with patient and family and that satisfaction. And so, you know, we're in a situation where family caregivers are telling us there's major room for improvement when it comes to communication, especially the kind of real-time communication that addresses the urgent needs that we see not getting responded to. And then that communication method influences satisfaction. We're seeing that all through the data, and the current technology that's being used isn't cutting it, right? It just doesn't work in the way they need it to work. And so on the other side, providers want to use technologies to increase their family caregiver satisfaction, but we haven't found the right tech platform yet, is what they're saying. And so they're looking for that. So we also ask family and caregivers what they really want when it comes to real-time communication. So we'll talk more about this. And so this is where we're headed, this is the roadmap that you're going to see next to help providers understand exactly, you know, what your family caregivers want when it comes to real-time communication.
Rob, thanks a lot. This was enlightening, and I'm anxious to see what you mean exactly by what the family caregivers want. So, Melissa Kozak, CEO of Citus, can you pick up from where Rob left off and tell us what you've learned both as a nurse in the home and as the CEO of Citus?
Absolutely. Thanks, Tim, and thanks, Rob, for providing some real life examples there with your dad and your family. So what I'm going to do is walk through what family caregivers told us was most important to them when it comes to real-time communication with their hospice providers. In our research, we asked them to weigh in on a number of activities that, if their providers enabled real-time communication, it would have improved that experience and, of course, led to better responses on the CAP surveys they completed. So not surprising, if we go to the next slide, immediately receiving a response to an emergency or urgent question is the #1 want from family caregivers, right? Not surprising there. Because in the hospice setting, an immediate response to an urgent need can make all the difference in the world. The problem is, as Rob noted, today the industry isn't equipped with the right technology to meet the need. Many nurses give out their personal phone numbers to family caregivers. I know I did that routinely. But the challenge is that the nurse isn't always the one on call, right? And therefore might not be checking the phone. And on top of that, that text message that comes in and goes unanswered by the nurse won't automatically escalate because that family member didn't get a response. So in that case, what's the next channel? The family might try a phone call, which is also problematic because, especially if it's after hours and a call center rep fields the call and transfers the caller a number of times before hopefully connecting that family caregiver to the right clinician. So the problem here is, unnecessary delays in care, high anxiety for the family caregiver, and possibly unscheduled trips to the ER. But with the right message routing tools that have role-based awareness, that message can actually be delivered to the right clinician at the right time. And if for any reason that message doesn't get answered within an acceptable threshold, let's say 20 minutes, that message can then escalate to a supervisor. ensuring that no, important communication is missed.
Melissa, that's a great explanation of the problem. But I understand that that's exactly why you formed the company. Can you give me a concrete real world example of how Citus Health addresses that particular problem?
Yeah, absolutely. So if you have mom in the home and there is, a rash developing and the rash is getting larger and starting to be really uncomfortable, and it is after hours, that is an urgent need to get a hold of a clinician, a medical director, maybe, a medication needs to be called in. And the family members just want their mom to be comfortable, right? So really, really important to connect on that and get the help needed in a quick manner. All right. So the second highest rated activity is the ability to conduct a group chat between the hospice clinical staff and the entire family. And as Rob noted, he has a big family, and this screen is indicating here a big family. Because today's caregiver is shouldering an increased burden between their work, their family, caring for their parent in the hospice setting, and they're also the point person, right, between the hospice provider and their entire family. Some of these family members could be hundreds or 1,000 miles away. Some of these family members may have a different perspective on whether to utilize the hospice benefit, and all of which have different questions, of course, and need to be kept in the loop on their loved one's status. So if there was secure group messaging, right, that allows the nurse, the social worker, the aide to update all family members at once on the daily activity with a quick chat through a message group, they can share a picture of their parent or even hop on a secure group video chat. And this provides a streamlined way for each family member to have their questions answered by the nurse. And that way, everybody is in the loop about the care, any changes to the status of the condition, updates to the plan. And this can avoid the multiple phone calls between family members to try to get the whole story or to coordinate the care. I mean, Rob talked about, trying to take his dad away on a trip and, the challenges there. So something like that, like this could be very beneficial to expedite that.
So Melissa, I'm going to push you a little bit further to
Sure.
tell us exactly how Citus Health addresses this particular. I'm assuming that the features you're talking about right now are Citus Health features, but
Yeah.
Exactly how do you do that?
Sure. So family members would have access to the platform, and they would have the message center where they can use, a laptop like in the picture, or a smartphone, or any computer. And they can be part of a one-on-one message with their family member's clinician, or a group message where their siblings or other family members are involved. Real-time exchanges here. It's multimedia, so that nurse can take a picture of mom's wound, send it on the secure chat. That wound is not saving to the camera on the phone, so it stays HIPAA compliant. And then if more conversation is needed, they can launch a video chat and really dig in to questions for that clinician to get a better sense of what's going on with their family member.
I get it now. Well, speaking of clinicians, what about doctors?
Yes, absolutely. And we're actually, that's the next slide. We're going to be talking about the medical director here because, the medical directors have a ton of responsibility, but they have very little time. However, for the family caregivers, they do want more from the relationship with that medical director. And the technology we were just talking about enables a video face-to-face interaction rather than just a text or a phone. And this absolutely results in a more personal relationship and assurance that the medical director is available for the patient. The video visits really enable that MD to quote unquote meet, with more patients and family caregivers, even on the fly. And they can do this from their office, they can do it from home. So it makes it extremely efficient for the medical director to expand their reach into the census. And really, can you imagine how good your family caregivers would feel just being able to have that one-to-one? And for the medical directors, the ability to use technology definitely makes their life easier and would make them happy too. And, while we all understand that the future of reimbursement for this type of video chat service is unclear, the impact on the quality of care and the family caregiver satisfaction is crystal clear. I've personally heard many stories from the family caregivers of patients that I've directly cared for over the years who just wanted to have the assurance of a face-to-face visit with that medical director. And because that wasn't available to them digitally, they resorted to bringing their loved one to the emergency room, just to be seen by physician and get that peace of mind. So sometimes a seemingly simple solution like a secure video chat with a medical director can really go a long way. And look, I'm sure you all lived through a similar example that Rob talked about with coordinating, I think it was a hospital bed he spoke of, where it takes multiple phone calls and voicemails to secure that piece of equipment for a patient. And it could take 2 or more phone calls to coordinate whether it's medication or equipment. And that could be, 2 calls too many, since any communication delays during the end of life care cause friction and pain. So today's more sophisticated solutions can instantly connect clinical teams, partners, physicians, DME suppliers, pharmacies. There's a lot of stakeholders involved in the care. And any others, right, to quickly coordinate the orders, the delivery, any pickup of those essentials via secure instant group messaging, avoiding all of the phone tag, the 3 days of phone tag, right, and frustration. So if you can imagine a situation where you need to get in order, maybe increase the dose of Lasix for mom because mom is experiencing fluid retention, and you can easily communicate that with a clinician via a secure message. And then in some cases, if a signature is required on that order, paper and fax just add time and coordination challenges. So by moving that signature process online, solutions like ours with sophisticated technology can enable appless signature and expedite the signature process. And appless, just, look, we all know physicians will not download apps. They don't want to log into another portal. But with our solution, they don't have to have a username. They don't have to have a password. The hospice can actually send either to their email or a mobile number a simple SMS that includes a secure link to that order that they need to sign. They can simply sign it on any device, and that faster approval process takes place very quickly. All right. So I'm sure you all also lived through schedule changes. As a nurse, I was constantly having to change my schedule, which caused downstream disruptions to all the other patients that I had on my schedule for that day. And I had to communicate via phone each time, to the family, because that's all that was available, often getting voicemails, which led to patients and family caregivers not knowing that I was rescheduling, or being surprised that I didn't show up, or that I did show up at a different time because they never checked their voicemail. And family caregivers definitely understand that emergencies happen and schedules change frequently, but they still need to be in the loop, right? So as we discussed before, they're wearing many hats and need to plan their day, including shopping trips, work, and time to take care of themselves. So the more immediately they're alerted of a change in the nurse's schedule, the more quickly they can adjust their day and avoid long waits for that nurse or aide to come. And as we all know from our own experience, we have a better opinion of any organization we're dealing with when they effectively communicate changes in a timely manner. With the Citus solution, for example, instead of calling or texting individuals, that nurse can send one quick group message, alert all the stakeholders at the same time. And by the way, it works both ways. So the family caregiver has the ability to outbound a message and request a schedule change, which can quickly alert the office staff or the clinical team immediately in one message. So there you have it. I mean, straight from the family caregiver, the top 5 real-time communication needs that family caregivers wish could be done via modern technology through a computer, tablet, smartphone, right, where they're living today, anyway, in other areas of their life, that would dramatically improve the hospice experience and their overall satisfaction.
Melissa, you know what? I have been in the same situation with a hospice as a family caregiver, and I can relate to what you mean. It sounds as though this is where the Porter research has found that the CAP scores go up, is this communication. So talk to us about what Citus is actually doing with the family caregiver in mind.
Absolutely. And, you know, we really built Citus with that family caregiver in mind, because we really know that they are the ones that are coordinating the care for their loved one. And so, you know, what you actually have on your screen here is some of the most critical requirements for virtual patient care. We at Citus, we really see that there are lots of you know, communication and coordination opportunities that are being done in these outdated methods that Rob talked about: email, phone, fax, yet they're all needed to have this seamless care. And many hospice providers are picking up, you know, one or two of these types of solutions. So maybe a secure messaging app, or maybe Zoom, or maybe something for signatures. But what we have in mind is a platform that incorporates all of these things. So instant care team messaging, family caregiver two-way communication that, by the way, translates 93 different languages, HIPAA compliant video sessions, electronic appless signature capture, customizable forms and surveys. We didn't talk a lot about that, but this idea that you can send a satisfaction survey directly to a family member, or maybe a proactive outreach to a patient or a family caregiver, assessing how are they doing, are they short of breath, are their ankles swollen? So some proactive interventions can take place. Educational support. So we have what's called an education center on our platform, where family caregivers can be kept in, you know, the knowledge loop on their loved one's condition and how best to support them. The ability to receive efficient broadcast messages about, you know, important updates with that hospice, or any weather concerns, and really EMR integration. And we put that last, it could have been first. This idea that none of this is happening in a silo. And we recommend that there is a platform where that data can be exchanged back into the EMR two-way. And Citus Health and our platform is integration first, very integration friendly, and can integrate into multiple EMRs. Finally, this idea, I'm going to use a fancy buzzword here, omni-channel. What that means is that the solution should be available to anyone, from anywhere, at any time, on any device. So whether someone wants to use an app or they don't want to use an app, they want to have a registration or they don't want to have a registration, that really now provides a multi-channel, omni-channel approach to care. So we actually published this checklist, and these are the most important elements that we feel home-based providers should consider when investing in virtual patient care. You can actually download this free on our blog. Our solution addresses all of these in a fully integrated manner, so you don't need to invest in multiple pieces of technology that don't talk to each other. And we think this is really important.
Oh, thanks, Melissa. You know, I think you've hit on something that everybody is concerned about. Communications in hospice and in all in-home care is, as you mentioned, largely lacking. But aside from the problems and the challenges and the fixes, Rob, I think it's your turn, and I want to hear more about what difference it makes. What's the word, omni-channel real-time communication, what the benefit is for a hospice and other in-home caregivers.
Yeah, I think it's interesting, Tim, because you know, we've kind of talked about at this point what the research told us, and then how you can address that, what they want, right? What these caregivers want. And now the real discussion revolves exactly around what you just said. If you do that and you create that environment, give them what do they want, what do you get out of it, right? As the provider. And I think, we went in and we asked them that. We said, hey, look, when we asked family caregivers whether they would choose one hospice over another, just based on the ability to increase communications, then 78% of them said yes, which is really telling them, like, look, here's what we want, and if you give us what we want, we're going to reward you in the terms of selecting you over people who don't do that. So that's a huge message, and I think it totally makes sense. So if you think about you're choosing between hospice providers for the first time, and you have to figure out which one's going to do a better job, you're going to naturally lean towards those who are using a format that you're accustomed to, that you think you're going to be able to communicate with better. So I think that's really important. And then the next question was asked is whether the family caregivers would give their hospice providers higher satisfaction scores. Would you be more satisfied if we were using these types of communication capabilities you told us you want? And 80% of them said absolutely. Right. So given everything that we just shared, it just also makes sense. They're going to feel more taken care of. They're going to feel more connected. And so I think the real message to kind of convey on this is they're telling you what you want, and they're also telling you if you provide it, they will reward you, which is a really nice thing to hear, that's going to pay off. That kind of investment is going to pay off. And so it's really a no-brainer for hospices to then go on and say, okay, let's engage in this. And I think, as you pointed out earlier, Tim, the survey data came from hospice, but you would also understand that this same thing relates to home health providers as well, right? So the data came here. And, when you talk about the higher CAP scores, then that's going to have an impact as well, because obviously, you as families are doing their research and you're getting published out on the CMS website, and you have referral sources seeing that, and you see some of these automated tools. There's lots of automated tools that when people are getting discharged from facilities, it's pulling this public data and telling them, here's the right people based on these scores that you should be able to go see for your next level of care, then it becomes really important. So I think that's critical, that they lead to more referral sources. And then I think in the end, really too, just putting these kinds of tools in place obviously lead you to productivity kind of gains. So for instance, if you're constantly having to try to catch up and call people, because as Melissa talked about, the challenges of running late for a visit or having to change a visit, and instead that becomes a quick message, or that you don't have to play phone tag, that your main response team to inbound requests doesn't have to play phone tag with people and communicate. There's obvious productivity gains that get tied to that. And so everything, we just talked about reduces the time your clinical staff needs to spend on those administrative duties and care for patients. And so, there's just so many causes for staff burnout and dissatisfaction relating to too much of that administrative burden. Staff's tough to find, so let's give them tools. Plus, many of the staff you're looking at now are younger millennial staff, and they're certainly used to the same tools that the caregivers are telling you you're used to. So, and Tim, I know that you understand and have an additional kind of take on, your CAP scores increase, but then how can that kind of satisfaction also benefit your organization? So I'll let you talk about this and how this kind of satisfaction that they're telling us they're going to get from this can play out in a few different ways.
Thanks a lot, Rob. This has been incredibly educational. I hope everyone who's listening agrees with me. I want to take what you've said and wrap it into one more practical thought of activities that a hospice or other in-home caregiver can do. You get patient satisfaction to increase using these communication tools. You get happier families, but who knows about it? How do you get the word out? If you've talked to marketing people, the first thing they're going to tell you is, if you've got something to brag about, you need to brag about it in a big way. So Let's talk about how word of mouth has changed. What do you do when you get a compliment, when you get a happy family, say at the end of a case? When I was working in home health, we had all these letters posted on the bulletin board in the break room. I don't know what good that did except to make us feel good. Do you still do TV and Yellow Pages ads? Remember what Rob said? His father, he was 300 miles away. So he never would have seen the TV and Yellow Page ads of any in-home caregiver where his father lived. So what does that mean? You have to find, now that you've found the modern communication tools, it's also important to consider who is it who's searching for your services. So Rob, go ahead on the next slide. I want to talk about your experience, Rob. It's usually the adult child. More often than not, it's a daughter who does not live nearby. She doesn't see your TV ads. She has no access to your Yellow Pages book. This person is going to use Google. They're going to go to the modern day word of mouth and say, who is the best provider where mom lives? And sure, some of them might use Bing, Yahoo, and Yelp, but Google is the elephant in the middle of the room. So what do you have to do? You have to make sure that you take care of, you nurture your online reputation with all of these sites, but especially with the big one. And that means you got to know and follow the rules. And Google enforces these rules. In fact, you can try it right now, or as soon as we're done, you can try it. Go to Google and search for home health in some city. Now, little parenthetical warning, don't do it in your city because Google also knows where you are. So if you do it from your desk, you're going to get skewed results. So, try something else. Try Google home cleaning in your city, or home health in a different city, or hospice in a different city. And what you'll see is that Google only puts 3 answers up at the top. And it has all these rules that you see listed here for who gets to be in the top 3. And among those rules is how many positive reviews you have and how recent those reviews are. So what that means is when you generate these happy families, having them respond to the CAPS scores is only half of the job. You need to brag online where everybody in the world can see how good you are. And the only way to do that is to push yourself to the top of the Google list by following the Google rules. So one last thought on the last slide. Every single person in your organization is in sales. So for example, when that adult daughter we were talking about calls and says, hey, thanks a lot. The mom's funeral was yesterday, and I just wanted to let you know that we really appreciate everything we did for our family. No matter who answers the phone, even the lowest paid receptionist needs to be trained to say, thank you so much for saying that. Listen, could you say that again online where other people can see it? Not only your receptionist, but all of your in-home care people, they're going to hear these compliments. So training them to know what to do about a compliment is as critical as what you used to do in the old days with TV ads and Yellow Pages ads and word of mouth. And what I have found teaching home care agencies how to do this over the last 4 years is that referral sources also will Google you and read your reviews. So that's just a kind of a wrap-up summary of where you can go once you have used these new technology tools to improve the scores that you get on CAPS to improve patient and family satisfaction. Then what do you do with it? You brag about it. So that leaves us enough time to go through your questions. And as Ryan mentioned in the beginning, There is a button at the bottom of your screen. You can use either the Q&A or the chat, and so you have already begun to do that. So Melissa and Rob, I hope you're ready. Joan wants to know what staffing needs are required to monitor these new technologies, these communications apps.
Sure, I'll take that. This is Melissa. Thanks for the question, Joan. There wouldn't be additional staffing needs for communicating through this platform. Actually, rather than monitoring, your teams will be notified in the channel that they prefer. So if an inbound message comes in, for example, your team could be notified in their email, which they're on anyway. They could be notified via SMS, in-app. So there's a number of ways, and we really like to work with our providers' workflow. For example, if there is a receptionist role, some of our customers will set messages to route to that receptionist role and then be forwarded to the appropriate clinical team members that need to answer that particular question.
Okay, great. Thank you, Melissa. Just another request to grab the Q&A button and type your question in. Ryan, I think you had a question or two that was given to you, correct? Ryan's on mute. Okay.
Yes, absolutely. Thanks, Tim. Let's see. One of the questions was regarding chasing down physicians to get their signature. Can the appless signature work with physicians even if they don't have to or don't want to download an app like the Citus Health app?
Yeah, this is Rob. I'll take that one. Yeah, so for, as Tim was kind enough to mention, I've been in the industry for decades. I have been hearing that long that that's the challenge, right? I don't want to download an app. I don't want to log into another portal. That is exactly what Appless is designed to do. So I do realize there are challenges with getting into and getting people to give you access to their emails and their SMS. But once the problem is there and they experience it, you don't have to download that app. You don't have to have the portal. You just have to understand who you're sending that to. It sends it to them as a notification through email or through SMS without any PHI, but identifies it as, hey, I'm from this agency, so that they'll recognize your agency. And then they'll be able to go into that secure environment just by tapping on the link that comes into it. And so, yeah, that is a common, that is the common thing that was driving the development of this kind of technology, is to engage with those physicians and those family caregivers that don't want to download that app or get in and have to have passwords to portals and things like that.
Okay, thanks a lot for that, Rob. Ryan, is there a question on your side?
Yeah, one more was, you capture and store these group chats or visit notes, and can they be downloaded to my EMR?
Sure, I'll take that one. This is Melissa again. Absolutely. So as we said, we're very integration friendly and can integrate in a number of ways. And one of the standard integration points we have is with the chat. So we think a lot of important conversations take place on the Citus Health platform, conversations that you know, traditionally are telephonic based and therefore not always captured in the medical record. But many of these conversations you would want to capture back in the medical record. So there's a number of ways that we can send that information back, but for sure, these records can be searched, they're auditable, and they could be made part of the main system of record.
Terrific. I think that's exactly what people wanted to know, Melissa. Thank you. And with that, we're getting up to the top of the hour, so I want to make sure that all of you know that you are invited to get in touch with any or all of us about any of the topics we've talked about today. You have the email addresses there. You can do a screenshot, or we'll just leave it up for as long as we can so that you can copy it down. But Citus is on LinkedIn, and there is an info@ email address for Citus. My website is up there. You can take a look at my newsletter, the Rowan Report, and my email address if you have questions about this idea of promoting and improving your online reputation. So let me wrap it up with a sincere thanks for all of you who have spent this hour with us today. I hope that you have learned as much as I have. There were a number of things here that I didn't know. So Melissa, thank you very much. Rob, thank you too. And get in touch with us. We'll be happy to continue to help you out. So long for now. This is Tim Rowan speaking for Citus Health. So long.